Hey, what's up, everyone? It's Bryan from the Xact I.T and Cybersecurity YouTube channel. Welcome to today's video where we're going to talk about McLaren Health and this IT disruption that's impacting this hospital up in Michigan yet again. They were a victim of a ransomware attack about this time last year or in the fall of 2023. And it appears they're having another disruption that has the markers of a cybersecurity incident. And we're going to talk about why that is, what's going on at McLaren, and how this is impacting patients and workers in today's video. Just remember to hit that subscribe button, like the video, and hit that notification bell if you want to be alerted when other companies are dealing with cyber attacks and how you can better protect yourself as well on this channel. So appreciate the support as we move towards 5,000 or 6,000 subscribers. So appreciate it. Thank you. So McLaren's Health, healthcare in Michigan hospitals hit with this disruption to their computers and phone systems. Now, that right there in that headline is indicator number one for me as a cybersecurity expert that this is a cyber attack. The phone systems and the computer systems should not be going down widespread if we're dealing with, say, an IT issue. Yes, things like updates can be rolled out and things like that, but that would be a failure of the IT department and IT systems to properly maintain their systems in a way that doesn't take down their systems. And in today's day and age, it's rare to see things like updates being pushed out taking down entire companies, even though we just saw it with CrowdStrike a couple weeks ago. Again, that's a rare event, and these events are typically rare in today's day and age. Typically what we see are cyber attacks that take down companies widespread and take down multiple systems that require businesses or that basically hamstring businesses or shut them down completely, as we see here with McLaren Health. So the Grand Blanc, Michigan McLaren Health Care was hit by a disruption to its information technology platforms and telephone system, affecting all 13 of its Michigan hospitals, ambulatory surgery centers, physician offices, and more. The health system said in a statement that they issued Tuesday. It said they are working to determine the extent of the disruption and do not have a time frame to restore functionality. We sincerely apologize for any inconvenience this may cause our patients, the statement said. This is indicative language that we see all the time when companies or organizations are dealing with a cyber attack. We don't really see this kind of language when, things like firewalls or switches or network devices or servers or things like that really go down. This is, 2 days now, essentially. We're in day 2 of this event. And really, we're not hearing anything from the hospital for the last 2 days other than very little things. Some McLaren websites, including those for its 2 health insurance plans, McLaren Health Plan and McLaren Health Advantage, were also down on as of Tuesday, which is August 6, 2024. So are you a patient? Do you work at McLaren Health? We'd love to hear from you in the comments. What are you experiencing? What are you seeing? We're hearing that they were diverting ambulances at one point, but they've changed that decision and they've moved back to accepting the patients. But we are also seeing tons of patients online through Facebook, through Reddit, through various places who are indicating that they have various appointments and services that are being rescheduled or canceled as a result of this outage. Patients are also reporting that they're having difficulty in getting test results for their labs and answers to medical questions from hospital staff and doctors. There was a spokesperson named David Jones who various media companies have reached out to, including the Detroit Free Press and the Associated Press. Many questions were asked in terms of very specific questions around whether this was a cyber attack and how they're handling different operational and operation situations within their hospital, meaning are surgeries being postponed? or canceled? How are they handling that? Is there any delay in any kind of service that they're providing? They want to know if these health plans are experiencing any issues, the McLaren Health plans, because the website's down, and was, the tech disruption caused by cyber attack? None of these questions are being answered by McLaren at this time. And Mr. Jones only said, as confirmed information becomes available, I will share it. Now, again, I said that this organization experienced a cyber attack about a year ago, and I'm sure they've learned a lot in that experience. And it wasn't too long ago, so I'm sure it's fresh in their minds. This is an indicative statement that somebody in, an attorney or a breach coach of some sort is telling these officials and the leadership of this hospital group that you don't say anything until we give you a prepared statement, and that's essentially what's going on here. There is, in this article that I have from the Detroit Free Press, a McLaren employee who spoke to the Free Press on the condition of anonymity out of concerns for job repercussions, said that the problem began Monday morning, and since some departments have been forced to completely shut down and workers have been told they must use paid time off during the work stoppage, those who don't have any more accrued vacation time will go unpaid. This is a very common thing that we're seeing with companies and how they handle cyber attacks. And one thing that I think companies are really going to rethink as they learn when they go through these attacks, just like they've learned the PR game when it comes to these cyber attacks in terms of how they answer questions to the media, what they say, when they release the information. I mean, it used to be the wild, wild west when, ransomware first started to really hit the scene, when we started to see these ransomware events that go into the millions of dollars. You would see companies coming out saying all kinds of things because lawyers didn't even realize there was a market yet for this stuff. Well, now lawyers are involved and they're coaching these companies on how to handle these situations on what to say. One big gap that I see with businesses as I evaluate these cyber attacks is this employee piece, where we're constantly seeing companies go to their employees and say, use your vacation time, take time off, or even go collect unemployment. When you tell employees this stuff, folks, they are going to run to the internet because they're pissed off. They don't know when they're getting paid, and now you're messing with people's emotions. People live paycheck to paycheck in America. They have bills to pay. The bills are coming, and the mailman is going to deliver the bills. The bills are going to show up in the email, and they're going to have to be paid. And these employees are being told right now that they potentially could be facing issues with their paychecks or not getting paid, or they have to use personal time, which, look, it's very frustrating as an employee if maybe they have a vacation that they already took, or maybe they have one planned, and now you're being told that you have to use this time and you don't know what that means because you're not even thinking that far down the road and you're not communicating this stuff to your employees. So all these questions are going to come about as a result of these decisions that are being made. Obviously this employee who said this, didn't want to have their name printed because, these are not things that companies want coming out. These are not, they probably know this isn't how you should handle this, but it's really a shame that we see companies over and over again trying to get through cyber attacks on the backs of their employees by asking them to do these types of things. And I think this is going to be a short-lived phenomena with cyber attacks where companies are doing this, because I think they're going to learn that the PR nightmare that they face from not only their employees, but future employees that may potentially, decide they don't want to work there because of this event, all the way through to, past employees and all that stuff. But these employees can all come after this organization, as there are a slew of lawyers on the other side of this who want to represent these employees in class action lawsuits to go after these hospitals and these organizations for how they handle these situations. This worker went on in this article and said, I have no other income. This is awful for sure. It's not the employee's fault. And this is how the employees feel. They feel like they ultimately get left holding the bag when it comes to these cyber attacks. And they had no, decision in the process of how much we're going to spend, what we're going to buy, what we're going to implement to prevent these cyber attacks. And again, if this ends up being a cyber attack, which it sure seems like it is, this is going to be the second one in less than 365 days on this organization. Second tech disruption at McLaren in the last year. In late August of 2023, a ransomware attack led the health system to shut down computer network and potentially leaked patient data onto the dark web, which ended up being 2.2 million records of healthcare information that ended up on the dark web as a result of the last ransomware attack against this group. The ransomware gang known as Black Cat Alpha V, which I've done videos on this channel, you can check it out, claimed responsibility for the August 2023 attack, posting online that it stole 6 terabytes of data, and it actually ended up being 2.5 million records, not 2.2. When it was first reported, it was 2.2. When I remember reporting it back in the fall or August of 2023. In October, they came out and said 2.2. So I guess it was revised up since then. It will be, this was one of the biggest leaks at the time. And they basically said that their back door was still running on your network, which this could be the second attack. Who knows? As a result of that. Cyber attacks and the data breaches that often accompany them are growing. A growing problem in healthcare, not only exposing the protected health data of patients, but also affecting the ability to provide health care. So this is becoming a huge problem. Major hospital systems, the healthcare industry is under a massive attack. This is getting the attention of a lot of people because it's impacting healthcare. You have Ascension Healthcare, you have United Healthcare. These organizations were all just attacked. Hospital systems are constantly being attacked. The healthcare industry is under attack by cyber criminals, and cyber criminals are successful because the healthcare industry just doesn't know what to do and they're not doing the right things, so they're constantly dealing with these issues. The industry needs to take things more seriously. Unfortunately, people don't want to hear that. They'll come in the comments, they'll come on this channel, and they'll say I make a lot of assumptions. I'll stop making what you label as assumptions when I start seeing better cybersecurity in the networks I evaluate on a daily basis. That's it for me today, folks. That's what's going on. I hope you enjoyed this live video. Remember, if you did like it, hit the subscribe button. If you're so inclined, hit that notification bell when you'll get notified when I put out videos just like this one. I really appreciate the support for this channel and everything that you guys do on this channel. It's a lot of fun going back and forth. You guys really make it a lot of fun for me to talk about cybersecurity and do cybersecurity. So check out the links in the description. We're trying to make this a really engaged channel. We have a lot of quizzes and stuff that you can check out, and questions around cybersecurity to test your knowledge on the channel as well. So we hope you enjoy all that stuff. It seems like you do. We get a ton of comments and we really enjoy interacting and reading those comments. So remember, if you have any comments on this video, drop them down below. We love to hear from you. I'm Brian. I'll see you in the next video. Take care, everyone. Stay safe.